Bismillahirrahmanirrahim. Starting with the name of Allah, the most beneficial and the most merciful. Today, the topic of my presentation is therapeutic potentials of vitamin D. And let me correct my name, it's Dr. Sindh Soneti. Next. This is my disclaimer. Next. And what are the objectives of my today's presentation? Introduction to vitamin D. What are the different sources of vitamin D? What is the physiology of vitamin D and the therapeutic potential of vitamin D? Please. First of all, what is vitamin D? Vitamin D is a fat-soluble vitamin and a hormone that is generally involved in the regulation of calcium and phosphorus metabolism. So we have three known sources of vitamin D that include sunlight, diet, and vitamin D supplements. The diet sources include fish oils, fortified milk, egg, beef liver, liver oil, shiitake mushrooms, and endogenous synthesis from skin. Different other sources of vitamin D including carrots, papaya, squash, broccoli, mangoes, sweet potato, and more. Coming towards the physiology of vitamin D, generally the vitamin D stimulates intestinal absorption of dietary calcium, activates bone resorption, and mobilizes calcium and phosphorus along with increasing renal tubular reabsorption of calcium and phosphate. How it acts on the skin, along with geographic factors and personal variations that include age, obesity, and different other factors like skin type or the person in which job is he involved. They act on the skin, so the precursor of vitamin D, that is 7-dehydrocholesterol, is converted into cholecalciferol, that is pre-vitamin D3, which in the liver or in circulation is converted into calcidiol, and in the renal it is converted into calcitriol, an active form of vitamin D. Now, what functions vitamin D has on skin? It is involved in the cellular differentiation and proliferation. It is involved in the cutaneous antimicrobial effect, and it is also involved in the innate and adaptive immunity of the skin, along with hair follicle cycling, and it has also a role in photoprotection as well as in wound healing. Now, it seems natural to incriminate vitamin D to the long list of skin diseases like psoriasis, vitiligo, and many other like autoimmune blistering disorders, even skin cancers. Coming towards the therapeutic potential of vitamin D, its role in cutaneous malignancy I shall discuss. Meta-analysis was performed to evaluate the association of vitamin D serum levels and dietary intake with cutaneous, melanoma, and non-melanoma skin cancers that demonstrated decreased levels of vitamin D in patients with skin cancers. That means there is an inverse association between vitamin D, blood levels, and cutaneous melanoma thickness at the time of diagnosis. So we can say that it may have a protective role in prevention of cutaneous cancers. Through which mechanism vitamin D acts? It acts by regulation of multiple signaling pathways that have implications in carcinogenesis, including hedgehog pathway, which has an underlying mechanism for BCC, basal cell carcinoma. It also involves upregulation of nucleotide excision repair enzymes. It also induces cellular arrest, triggers apoptosis, apoptotic pathways, inhibits angiogenesis, and alters cellular adhesions. It is also involved in the prevention of certain molecular environments like metastasis. Tumor metastasis depends on the tumor microenvironment. Coming towards another disease, that is psoriasis. Observational and experimental studies, including randomized and non-randomized controlled trials done on patients with psoriasis, demonstrated decreased levels of vitamin D in patients with psoriasis. Low serum 25-hydroxy vitamin D levels may be associated with comorbidities in psoriasis patients, including metabolic syndrome and cardiovascular risk. As inflammation and angiogenesis seem to be cornerstones in the pathogenesis of psoriasis. So the role of vitamin D as an anti-angiogenic and anti-inflammatory, which is lost in psoriasis, may contribute to the deficiency of vitamin D and its role in psoriasis. What is the mechanism? The human cultured keratinocytes, when exposed to calcitriol, showed marked inhibition of growth and accelerated maturation. It also suppresses the Th1 and Th17 cell proliferation, as well as it induces the T regulatory cells. Another condition, that is acne, a study on 80 patients with same number of controls was done, and it demonstrated a decreased vitamin D levels in almost 48.8% of patients with acne and 22.5% healthy controls, which also indicates there is an inverse relationship between the severity of acne and deficiency level. That means increased vitamin D levels may also lead to the development of rosacea. Hair loss. A study on young adult patients was done along with healthy controls, which demonstrated decreased levels of vitamin D levels in 81.8% cases along with 45.5% controls. So the dietary factor is also involved along with other factors like stress. So the screening for vitamin D level and supplementation with vitamin D in cases with deficiency would be beneficial in the management of hair loss. How it acts? Actually, the optimal concentration of vitamin D is necessary to delay the aging phenomena, including hair loss. So vitamin D or vitamin D receptors promote the ability of beta-catenin to stimulate hair follicle differentiation. And vitamin D receptors regulate directly or indirectly the expression of genes which are required for hair follicle cycling, including the hedgehog pathway. Another disease, that is vitiligo. A study on 50 patients and 47 controls was done, and it demonstrated a decreased level of vitamin D levels in patients. There was also seen relative deficiency in controls, so the deficiency of vitamin D may be a causative factor in vitiligo because vitamin D increases the tyrosinase activity and causes melanogenesis that causes repigmentation in the vitiligo patches and macules. Coming towards another disease, pemphigus vulgaris and bullous pemphigoid, a study on 35 PV and 32 BP patients with 28 controls demonstrated a decrease in vitamin D levels with PV and BP patients. And autoimmune bullous severity score was inversely associated with vitamin D levels. So vitamin D through immune modulatory functions, including B cell apoptosis, Th2 cell differentiation, apoptotic enzymes regulation, and T regulatory cell functions may have a role in autoimmune blistering disorders. So the frequent question that arises is how to ramp up vitamin D levels without causing sun damage. We have 4 points. That is, be smart enough about sunscreen, put the D in the dining, that is dietary factor, take a vitamin D supplementation, and consider a topical vitamin D. So I don't believe vitamin D is the answer, because how vitamin D is integrated in the field of dermatology has been appreciated very well. So my call is that supplemental vitamin D should be the preferred recommendation so that the deleterious effects of vitamin D should be avoided. Something so simple, that is vitamin D supplementation, could improve the health status of millions and so becomes an elegant solution to many of our health problems today. A mentor is someone who sees more talent and ability within you than you see in yourself and helps bring it out. May I take a moment to appreciate my mentor, my professor, my counselor, my guide, Professor Dr. Daulat Rai Bajaj, for blessing me with an opportunity to stand here and talk. Thank you.